whether you have an injury or you're trying to prevent injury, having some type of scraping routine is really helpful for facilitating the recovery of those muscles. Now, the thing though is that I have patients ask me all the time about like, how do I use this, right? So what we're gonna do is we're gonna go through a little bit of what to do, but then also some tips and tricks, right? Keep in mind that I have done this scraping technique for thousands of patients at this point. So I've learned a few things along the way and I want to share them with you. Generally speaking, you want to do the muscle scraping for about 1 to 2 minutes per area before then moving on to another area. For a larger muscle group like your quads or your hamstrings, you could spend a little bit more time. Now, a general rule, if your leg is in a more relaxed position, you're going to be able to get to the deeper part of a muscle versus if your muscle's more contracted, you're going to get to a more superficial area. So if my knee is bent, then I'm gonna get to more superficial part of my quad versus if my knee is extended, I'm gonna get to the deeper part of it. Now, in this case, I'm going over pants, but this isn't actually ideal, right? So like, I wouldn't recommend this as this is the standard of what you should do. It's better than nothing, but it's much better though to use some type of emollient or lotion and to be skin on with the metal because it's gonna help to kind of get to more of those fibers. Now, that being said though, we're gonna do with this what we can. Now, first, what I like to do is I like to start with the more rounded edge here, okay? That concave, and then I start going through at an angle, so at like a 45-degree angle. And Dr. John had explained a lot of this before, so I won't repeat myself too much. Make sure to check out that video. But in terms though of this quad, you see how I'm kind of going through this inner portion, through the center, and then kind of all along the side. I'm gonna spend about a minute or so doing that. Because these muscles are big too and you need a little more force, you see how I'm holding it on either side here? So then I hold it on either side at an angle. And what I'm doing is I'm at an angle where it's kind of facing toward me a little bit, because then I can kind of, it's almost like I'm kind of pushing everything up toward my body, okay, toward my center. And then I'm gonna get to this part of my quad. Now, like I said, if you want to get to a more superficial area, you'll feel this a little bit differently. Then I like to go on my knees and then I'll kind of come around here like this, because then I can really feel this along this part of the IT band and that part of the quad. And don't go over the bone, but you can come just above that. So if you've had this nagging patellar tendonitis and you know that this part of your quad is tight, this is really useful to do. The other thing that I'll do, I'll come on my knees and then I'll get to this area because now my hip is extended, so that muscle is on stretch a little bit more and I can get to this deeper portion. And then make sure to do both legs. At Mobility Doc, we carry the Sidekick tools. So we regularly use the Swerve and also the Echo. The really cool thing about the Swerve is that it has all the sides you can use for different parts of the muscle. So this part that is more concave, that's really good for going along the contour of a muscle and it kind of hugs it. Versus if you want to go a little bit deeper, then you use the convex portion. So then that is going to be helpful for getting to that area that's a little bit deeper. Then the thing that's pretty cool then is that it has these like more kind of like pointier kind of edges that aren't sharp, but then you can kind of get into some like harder to reach areas.